Okay. So we'll begin by talking about some of IAPOH's past work. The work group over the years has helped to support public comments on various Illinois Department of Transportation planning and funding proposals. IAPOH's also shared best practices and successes on built environments regarding physical activity. In addition, the Active Transportation Alliance led advocacy to increase Illinois Transportation Enhancement Program funding to a threefold increase, which was about $75 million. Some of our recent grant work was the SPAN program. That was a 5-year grant that ends this year, in addition to the BRIC grant. These grants really helped launch the work more robustly. We were able to bring the National Active People Healthy Nation campaign to Illinois, which you see in the logo in the lower right-hand corner. Our projects through SPAN and BRIC work to leverage the influx of new state and federal funding for biking and walking infrastructure. We've also helped build capacity and get communities ready to take on the new funding opportunities. So our new grants, we will be doing SPAN again for the next 5 years. In addition, we have the Illinois Department of Public Health COVID Equity Physical Activity Grant. And you can see on the slide that both of them encompass the entire state, as well as county specific and regional specific. So now I want to talk a little bit about opportunities. And I do want to say that the purpose of this work group is to gather all of your advice, feedback, perspectives, not to necessarily help us implement these grants. So with that said, we want to help continue to help communities implement things such as the federal bipartisan infrastructure law, increasing Illinois Transportation Enhancement Program funds, and also supporting community input into the IDOT Active Transportation Plan, which you can see one of their ads on the side here. And so now I'll be moving along. We have 3 main goals in the physical activity policy and environments area. The first goal is improving the integration of public health, planning, transportation, and green spaces to influence policies and plans that impact access to and opportunities for physical activity for everyday folks and everyday life. And I'll give everyone a second to look over that strategy. And we will be going back to these strategies for the discussion, so no need to memorize things. Our next goal is increasing the capacity of local communities to integrate safe, accessible, affordable, and culturally appropriate PA and health supports into community plans, policies, and their actual environment. And I'll pause here. This one has a few more strategies than the previous. All right, and our third goal is ensuring federal and state infrastructure and transportation funds are allocated appropriately in ways that promote healthy, safe, accessible, and culturally appropriate PA and active transportation. And you can see we have one strategy under this goal.